Your Excellencies, ladies and gentlemen, thank you for this opportunity. It is truly an honor to say a few words as a practicing One Health researcher about the value of the One Health approach and the creation of a multilateral One Health high-level expert council. In 2004, I was fortunate to be among the first cohorts of graduate students trained in this emerging field. That same year, in the wake of the global SARS outbreak, the Manhattan Principles presciently stated that a broader understanding of health and disease demanded a One Health approach, which required a coming together of human, domestic animal, and wildlife health. These were revisited and updated in late 2019 as the Berlin Principles on One Health, a call to action that brought together representatives from 47 countries in response to global biodiversity loss and climate change. The establishment of this council to share the science with policymakers and the public, and very critically to help promote multilateral action, is a welcome step forward. Scientists from different backgrounds have started integrating historically siloed One Health fields, but governments and intergovernmental cooperation are needed to lead with a One Health approach to transform our world. By building on foundational science, multilateral organizations must take clear and bold actions, setting goalposts that subsequently enable other governmental leaders, donors, and implementers, as well as diverse societal actors to follow. Since the mid-19th century, when SARS-CoV-2 probably diverged from its closest known bat virus relative, the world's urban populations have grown 600%, while globally an area roughly half the size of the United States has been deforested and carbon emissions have quadrupled. As of 2020, 75% of the terrestrial environment was considered severely altered by human actions, and global mammal biomass was 60% domestic livestock, 36% humans, and just 4% wildlife. Land use change is the biggest factor driving biodiversity loss, and there has been a 68% average decline in global wildlife populations in the last 50 years. During this period of unprecedented change, SARS-CoV-2 quietly evolved from that shared ancestral bat strain and went undetected in a reservoir or intermediate host. With that land use change came increased human and domestic animal contact rates with wildlife. In research we published earlier this year, we showed coronavirus detection rates significantly increased along a live rodent supply chain, with 50% of individuals testing positive at slaughter in restaurants. COVID-19 and other zoonotic diseases have emerged because we have clearly pushed and shaken ecological systems too far. Borrowing from the Berlin Principles, this expert council can support policymakers to develop One Health solutions for disease threats that meaningfully integrate biodiversity conservation perspectives with human health and well-being, that use holistic and forward-looking approaches to the detection, prevention, monitoring, control, and mitigation of emerging or resurging zoonotic diseases, that build participatory, collaborative relationships among governments, NGOs, indigenous peoples, and local communities, and that invest in educating and raising awareness for global One Health citizenship and to approaches for young to old. One Health researchers are eager to support this council and will bring the enthusiasm and passion we need to tackle the big challenges ahead.